Hello, my name is Belle. I am OT Clinical Educator at Rockhampton CQ Health Clinic. Today I'll be talking about occupational therapy services within a paediatric setting. So CQ Health Clinic is a public access clinic which provides practical learning for students studying physiotherapy, OT, speech pathology, oral health and podiatry. Within occupational therapy, we work within a primary paediatric setting. OTs enable children to do activities they need or want to do, and to facilitate children's engagement in their roles within their everyday lives. Occupational therapists aim to enable and optimise children's occupational performance and participation to fulfil their life roles. A child's occupation include things they want and need to do in their life which is appropriate for their stage and age of development. Children carry out these occupations in a range of different environments and ways. The occupations for young people are centred around play, learning, and includes getting dressed, eating, going to school, making friends, and being part of a club or group. A common paediatric caseload is inclusive of people with sensory processing difficulties, developmental and learning difficulties, autism and ADHD, trauma, self-regulation and challenging behaviours, and neurological and physical disabilities also. It also includes any child that has difficulty completing tasks and activities as well. Difficulty processing sensory information may be contributing to or interfering with a child's participation at home, school, and in the community. We have 8 senses, including auditory, visual, olfactory, gustatory, tactile, vestibular, proprioception, and interoception. OTs can assist in identifying sensory preferences and supporting the child to participate through sensory routines, environmental modifications, assistive technology, and goal-orientated therapy sessions. Self-regulation is a person's ability to adjust and control their energy level, emotions, behaviour, and attention. Difficulties regulating emotions can lead to inappropriate behaviours. In the clinic, we may see challenging behaviours that include negative thoughts or self-talk, aggression, and outbursts of emotion. OTs can assist by trialling management strategies, social scripts, visual schedules, sensory processing, role-playing, positive choice making, and improve language and communication skills. Difficulties with handwriting and fine motor skills are common referrals for a child to COT. These difficulties could include the ability to hold a pencil, speed and legibility when writing, cutting, eating, dressing, tying shoelaces, and hygiene and construction skills. OTs can complete assessments and activity analysis to identify difficulties within the area of interest and provide targeted therapy inclusive of writing aids and assistive devices. Attention and concentration often present as a child's inability to focus on a task. They may be easily distracted, have difficulty following directions and instructions, are unable to sit still and fidget a lot, and become overwhelmed easily by large amounts of information. There may be a number of factors influencing a child's ability to successfully complete their tasks, such as sensory processing and self-regulation difficulties, core strength, lack of motivation, learning difficulties, or the environment. These are areas an OT will be able to identify and work on with the child, along with education with their family and school. Play is one of the main occupations of a child and is a rehearsal for life's tasks. However, for some children, it is not an easy thing to achieve with others. An OT can work with a child to increase their social skills and be able to confidently communicate and play with children and other important people. We can learn about the emotions and social roles and educate the student and child to increase their confidence in negotiation and conflict resolution, adapting to change, and developing problem-solving skills. OT can assist children and their families to develop necessary skills to feel ready for transitioning into school. These skills include self-help skills, being able to manage their lunchbox, drink bottle, social skills and emotional regulation, being able to play cooperatively with others, fine and gross motor skills, holding pencil appropriately, attention and following directions, along with problem solving and cognition. Activities of daily living are tasks that must be completed daily to independently care for oneself. A child's ADLs may include dressing, toileting, showering, eating, drinking, sleeping, and brushing their hair and teeth. OTs can assist by identifying underlying difficulties, improving skills, providing opportunities for targeted practice, enhancing carer understanding, and developing new routines and habits. OTs can also enhance performance and participation of any other tasks that a child may be having difficulty completing. These may include gaming, crafting, sewing, computer use, playing board games, swimming, or engaging in family and group activities. OTs can use these activities view these activities as a whole before breaking them down into smaller components. They then consider the activity demands on how it is typically performed, as well as the abilities, equipment, steps, environment, safety precautions, and personal factors required to make recommendations or modify the tasks to ensure that they're achievable for the child. Best of luck for your studies. I hope to see you in the clinic this year. Thank you.